Well, hello class, and welcome to my Critical Reasoning Thinking Like a Nurse video. I put this video together to help you prepare for your first exam in nursing school, one of your first exams in nursing school. One of the things that is most difficult for students when they first start taking nursing exams is this critical thinking or critical reasoning piece, which means that you must think like a nurse. And since you haven't been in nursing very long, sometimes this is the most challenging part of an exam. So we're going to go through some pens up tips on ways that you can begin to think like a nurse so you can be successful in your nursing exams. So the first thing I want you to think about when you're taking an exam, when you read a question, is what is the question asking you? And I know this sounds really, well, duh, of course I'm going to think about what the question is asking. But a lot of times students get questions incorrect on exams because they didn't answer the question. So you get a scratch paper during your exams, and I encourage you to think about what that question means in 3 words, 3 to 5 words, and jot those 3 to 5 words down so you know exactly what answer choice you are looking for. Is it asking you about the side effect of a medication? Then you would write side effect and then the name of the medication or classification of medications. Is it asking what would the nurse do first? So you want to make sure that you write that one down as well. Always think about the nursing process, and remember there's certain steps in the nursing process, and it's something that we do as nurses which guides our care. So the very first thing that you do as a nurse is you want to assess your patients. And remember the nursing process, if you remember the acronym ADPIE, A-D-P-I-E, assess, diagnose, plan, implement, and evaluate. So first thing you need to do is always assess your client. The second thing you'll do is diagnose the problem. Now, you are not a provider as far as like a physician or a nurse practitioner or physician's assistant. So you're not diagnosing the patient with a medical condition, but you are diagnosing them in what this problem is in a nursing diagnosis way. Now, key, pens up. You do not need to know exact nursing diagnoses for your exam. NCLEX does not use nursing diagnoses. It's something that some nurses don't use at all, but we want you to think about, you need to identify what the problem is with your patient, right? You assess them, you listen to their lungs, you ask them questions, you look in their chart. Anytime you're gathering data, you are assessing. So if you're getting a blood pressure, even though you're doing something, you are gathering data. That's an assessment piece. Then you're going to plan. Once you figure out, okay, I've assessed my client, I can tell that their lungs are filled with fluid, and then I'm going to diagnose. I know that they have alteration in fluid status, and you know that what's going on with the patient, maybe it's a pneumonia or a fluid overload or something like that. And then your plan is you got to get rid of that fluid out of the patient's lungs. So there's many different nursing implications and interventions that you can do in order to get that patient back to a healthy state. The provider, the physician, the nurse practitioner is going to write the orders for that, and then the nurse is going to implement those orders. So the implementation phase then is following through, and there's a lot of nursing things that one can do without a physician's order, and we'll get into scope of practice in a minute. And then your last phase is an implementation, could be with some of the medications that you're giving. If a patient has medications such as an antibiotic which are going to help cure this pneumonia in their lungs, then that's part of the implementation phase. And then evaluate, you're going to see, did that antibiotic work? Did that medication work? Did my positioning of the patient make them feel better? And so forth. And then you keep on doing this nursing process over and over. So here's an example of a question that you might see on an NCLEX exam, a nursing exam, NCLEX. A nurse is giving a medication. What should the nurse do first? So before you look at the answer choices, so cover those up. Before you look at the answer choices, think about what is that question asking you? Well, it's a priority question because it's saying first, so you know that all the answer choices may be correct. You need to figure out what is the priority for that patient. So what would the nurse do first? So make sure you write down first and then medication. So what would the nurse do first with a medication? So A, evaluate the client's response. Well, that's something nurses do when they give medications, so you can't eliminate that. Make sure you are eliminating incorrect answer choices instead of trying to find the right answer choice. B, assess the client for allergies. Is that something you would want to do as a nurse? Well, yes, absolutely. Would I want to do it before I evaluate the client's response? Yes. So now you can eliminate A, so you're left with B. C, administer the medication. Well, do I do that before I check for allergies? Well, no, I need to check for allergies first. You're going to eliminate C. D, place the order for the medication in the client's chart. Is that something that nurses do? No, it's not. It's not within our scope of practice. We do not write prescriptions. That is outside the scope of the practice. That's the physicians, the nurse practitioners, the healthcare providers' job. So you would eliminate D of that. So the correct answer choice is B, assess the client for allergies. And that is the first step of the nursing process, is assessment. Now, I was talking a little bit more about scope of practice. So let's say you have an RN and an APRN, a nurse practitioner or a physician. What are the different things that a nurse can do and different things that the physician can do? We always talk about scope of practice in nursing, and we do not work outside of our scope of practice. Sometimes it gets a little bit fuzzy as you're just entering into this nursing world on what can nurses do and what can't they do. Here's another example. Again, before you look at the answer choices, just read the stem of the question. A client calls the nurse and explains that he is experiencing hives after taking a new antibiotic. Choose the best action by the nurse. So, what is this question asking you? Take a minute to think about it. You can pause. So what did you think? Well, you know what it says best, so you know, again, this is going to be possibly a priority question, meaning that all the answer choices may be correct, maybe not, but they may be because it says best. What's the best action by the nurse? And you know that the client is experiencing hives and they're taking an antibiotic. So I would say hives, antibiotic, priority for the RN. So A, tell the client to take half the dose with the next dose. Well, is that something that is within the scope of nursing practice? No, it is not. Nurses cannot change the dose of a medication, so you would eliminate A. B, skip the next dose and take Benadryl. Well, is this something that is within the scope of nursing practice? Well, you are telling the client that they need to skip the dose, but just one dose. So this doesn't sound like something that would necessarily be in the best interest of the patient, but we can hold on to this answer choice. C, stop taking the medication. What would that do? Is that within the scope of practice of an RN? Well, if we think that this patient is having an allergy, which it sounds like is what's going on, then yes, it is within the scope of nursing practice for the nurse to stop the medication. So I like this answer choice, so I would keep this. D, continue the antibiotic. Well, what would that do? Well, continuing the antibiotic could make this allergy much worse. And remember, your patients do not always continue to follow up with the care that you have suggested. You always have to assume that whatever you say is the last thing that you're going to say to that patient. And your number one priority is to keep them healthy and alive. So you would eliminate option D. And between B and C, stop taking the medication is the safest choice. Patients can die of anaphylactic reactions from medications. It absolutely happens. So your first priority is to make sure that the client does not take that medication. Use only textbook knowledge. Using only textbook knowledge is a very important point when you are taking nursing exams. A lot of you have much experience in a wide variety of healthcare arenas. Be very careful not to think about, well, what did that physician do or what did that nurse do when this situation may have happened. Not all nurses and not all physicians use textbook knowledge. The NCLEX exam is a national exam. So there are different common practices and policies that occur on the East Coast and on the West Coast, and many variables in between. So you want to be careful about using your experiences to gauge how you're going to answer questions. You really have to use textbook knowledge. So think about, what did the textbook say, and try not to make up stories. We will continue this video in part 2. Thank you.